Cancer has touched all of our lives, some of us directly, some of us through the people we love, and all of us through a shared hope of a world where this disease loses its power. Cancer is more than a diagnosis. It's a battle that tests courage, spirit, and the limits of what we believe we can endure. Penn State Health not only acknowledges that challenge, we are rising to meet it, fueling the work that brings us closer to cures, breakthroughs, and brighter tomorrows. Full of stories of strength, innovation, and hope, our special Conquering Cancer starts now. Penn State Health is fighting cancer on every front, bringing together a team of researchers, doctors, nurses, and caregivers who refuse to give up. We're tirelessly seeking promising new ways to find and treat cancer, helping your family make well-informed decisions. Good evening, I'm Liz Kepner. Tonight we're taking you inside Penn State Health St. Joseph Medical Center, where expert teams are working together to deliver world-class cancer care close to home. You'll meet a mother and daughter whose shared breast cancer journeys are a powerful reminder of the importance of screening, genetic testing, and family support. We'll also explore the Cancer Risk Evaluation Program and the latest advances in treatment and research, plus a closer look at a new minimally invasive procedure for prostate cancer, now available at Penn State Health St. Joseph Medical Center. It's a night of inspiring stories, expert insight, and hope for the future of advancing cancer care. And with that, let's send things over to Christina Butler for our first and second patient stories. Hi, Christina.
Hi, Liz. Genetic biomarkers can reveal cancer in its early stages, sometimes before symptoms ever appear. For Tammy Hughes, genetic profiling identified cancer risks for her daughter Ashley at a young age, with life-saving results.
The radiologist came in and confirmed that it was cancer, and my heart it dropped. It didn't surprise me too much, but yet it did at the same time, because it was a lump that was very new, and I think I just shut down. Finding the strength came from my kids, my husband, and my kids. So I found out that I had the BRCA1 mutation. My dad at the time was going through prostate cancer. He passed away a year after I had my diagnosis. He had been battling it 8 years. So I knew from everything with the evaluation for the genetic part of it that I needed to treat this a lot more aggressively.
And so her father was diagnosed with prostate cancer, and so you think that a male cannot carry or inherit a broken copy of a breast cancer gene, but indeed her father did, and passed it on to Tammy, which is what made Tammy at a much higher risk, heads and shoulders above the general population, to develop breast cancer.
So I opted for bilateral mastectomy. I was fortunate to be able to get immediate reconstruction. It did not go out into my lymph nodes, so I had sentinel lymph node biopsy. At the time, they did both sides. After I was all healed from that, I opted to have my ovaries removed. I knew that my risk was 50%, that I could have cancer come back in the other breast within 5 years. So to have them both just removed, to me, was my best option.
And the fact that Tammy tested positive was really life-saving for the rest of her family. And Ashley did indeed inherit that BRCA gene mutation, and she had increased screening for a while, but then unfortunately developed breast cancer at a very, very young age.
When we found out that she had the BRCA1 mutation, we kind of anticipated it would be in her future, but we figured it would be if that would be much later, and definitely not at her age. That diagnosis was rough. I had many nights that I just cried because I knew what she was going to go through.
I met Tammy in 2013. I was just a couple years into my career as a navigator, and she was so upbeat, and I remember Ashley back then being her cheerleader. And then back then in 2022, I met Ashley, and Tammy was her cheerleader. I was a little sad at first. I had hoped that Ashley could avoid going through what her mom went through, but they were always by each other's side and being supportive, and they were a great team. They're just a wonderful family and a great mother and daughter.
I was 21 when I knew I had the BRCA1 mutation, because she had already laid the groundwork for the genetic testing. I was able to kind of slide on in, get myself tested as well. Because of the BRCA1 mutation, knowledge that I have this, I was aware of my body, very aware of what was going on with it, and caught it early enough. So through paying attention, I was able to catch it, and I am here 3 years later.
Genetic testing actually informs not only the other recommendations, because now we know that Ashley is at risk for ovarian cancer and some of those other cancers associated with that BRCA gene. So we continue to follow her and, really make sure that she's getting the screening that she needs, and she's very, very diligent about returning for her care.
I graduated Penn State in 2012. We bleed the white and blue.
Having a positive attitude just helps you get through everything. Those folks can kind of look towards the future and know that they're gonna be okay. I think that's how both Tammy and Ashley were. They looked for all the positives, and they looked to be inspirational to others.
Knowledge is power. Knowing is better than not.
As quick as it broke me is as quick as I knew I had to pull myself together because she was going to need me. And that's exactly what I think I did.
You did awesome with it. You were more than mom, you were super mom. You were my rock. Oh, I'm gonna cry.
Liz, this mother-daughter duo truly facing cancer with courage, thanks to the care they received at Penn State Health St. Joseph Medical Center. Back to you.
All right, thank you, Christina. We're joined now by our own Dr. Marc Rovito, Vice President and Physician Leader for Cancer Services at Penn State Health. Dr. Rovito, it's always great to see you and lending your expertise to us. I think there was not a dry eye in the studio after that story. No, you've had the unique opportunity to care for both a mother and daughter as they each face breast cancer. What stands out to you the most about their journey and strength as survivors?
It started with Tammy's genetic diagnosis. It really did. Obviously, she developed the cancer. Her genetic diagnosis helped lead us to Ashley. And having that ability to bring Ashley in early, that's really important. And that's going to be becoming more and more and more important as we go on in that discovering cancer in patients. And
their story reminds us how important early detection really is. What should women know about the importance of, screenings and mammograms?
They save lives. It's very simple. Yeah. Catch them early, you can treat them early, you can cure them better. If they go on later, it's much, much harder.
Now, treatment has evolved in recent years. What advances are you most excited about?
Some of the immunotherapies, the genetic treatments we have, the immunotherapies, especially for patients who are triple negative, using some of the immunotherapy in combination with chemotherapy, that's really making an enormous difference in patients and their survivability and curability. So those are some of the things, the new developments with genes, the new developments with some of the immunotherapies we have, that's critical, and that's made a huge difference already.
Penn State Health continues to expand its cancer expertise across the health system. How does the collaboration among the locations and specialties improve care for the patients?
All care should be able to be delivered locally, but not all care can be. Having that ability to have those close relationships with the folks at the Hershey Medical Center, the Cancer Institute, really makes a big difference for our patients. Sending them there for that specialty care, the care they can't get in the community, gives them that additional depth of coverage, that additional depth of security, and they feel much better about their care in general by having that ability to have that linkage.
I was going to say, what does it mean for these patients to have, this expert cancer care so close to home and supported by a trusted health system like Penn State Health?
Yeah. Well, the majority of cancer care is delivered in the community, and I think we need to understand that, grasp that, embrace that. Patients want to have their care close to home. But having that security blanket of that additional coverage is critical, and that's what makes Penn State Health special and important for the community.
Dr. Rovito, thank you so much for joining us. We always appreciate when you're here, and we look forward to seeing you again. Now we're going to send things back over to Christina.
Okay, thanks, Liz. And we are here with Ann Welsh, Chief Mammography Technologist at Penn State Health St. Joseph Medical Center. And thanks for being here. And screening guidelines, they can sometimes be confusing. So
they can be.
Can you tell us right now, what are the current recommendations for when we should start getting mammograms and then how often we should be getting them?
The American College of Radiology recommends that women begin mammograms at age 40.
and then yearly. But women who are at high risk, we tend to start them earlier, depending on when their relative was diagnosed or if they've tested positive for the BRCA gene. And it may include more intensive screenings like MRIs.
And you, speaking of intensive screenings, you offer 3D mammograms.
Yes. Yeah.
Can you tell us about that technology?
Yeah, I've been around for a long time doing mammography, and 3D was such a big improvement over 2D because it was able to help the radiologist see through the dense breast tissue a little bit better. It takes angled pictures of the breast in 2 different views, and when it's reconstructed, they can go through it almost like a CAT scan and see things in much more detail and find hidden cancers that were unseeable before.
Wow. And you often say seeing it sooner really makes
Yes.
all the difference.
Yeah.
How does that play into not only treatment but recovery?
Yeah, seeing it sooner was our theme for Breast Cancer Awareness Month this year at Penn State Health. And it's very important to have your mammograms yearly, because if we can find a cancer small, it's much easier to treat and better recovery.
Okay, all right. Thank you, Ann Welsh with Penn State Health St. Joseph Medical Center for letting us get the inside information. Thank you. Liz, back to you.
All right, thank you, Christina. We're going to take a break, but coming up, we'll talk early detection through our cancer risk evaluation program. Stay with us. Welcome back to our special Conquering Cancer. I'm Liz Kepner. At Penn State Health, genetic consultation can greatly influence medical management decisions for at-risk patients. To learn more about Penn State Health's Cancer Risk Evaluation Program, we'll send things back over to Christina. Hi, Christina.
Hi again, Liz. The Cancer Risk Evaluation Program helps families understand their genetic risk when it comes to a cancer diagnosis. Let's take a closer look at the program.
Just like we have genes for the color of our hair and eyes, we're also all born with cancer genes. And so being proactive and understanding your family history, sometimes that information, once it's uncovered, can be really important in understanding, do you have a predisposition to cancer? Our Cancer Risk Evaluation Program is an invaluable resource for our community. It's really for any individual that would like to assess their risk for cancer. It can be based on their own personal risk factors, which could include breast density, it could include hormonal use, it could include family history, even lifestyle behaviors as well.
The Cancer Risk Evaluation Program is a program that really helps patients to understand what their risk is for inherited cancer syndromes. So it's designed to help anyone who has a family history of cancer, patients who currently have cancer. I kind of think about it in 3 steps. We have our initial appointment with our patients, and that's actually based off of a survey that they complete before they even come into the office.
And that does include their own personal risk factors. It includes their family history. The software will construct a pedigree or family tree, and it really helps us to understand what are the cancers in the family and should we consider genetic testing.
I like to tell patients I feel like I'm looking at a puzzle, like their family tree is kind of a little puzzle, and some pieces are bigger than others that make me think they have an inherited cancer syndrome. And then from there, we offer them genetic testing. And so after we gather that genetic sample, we get them their results, and they come in. So our 3rd step is they come in with that follow-up visit with either Dr. Rovito or Dr. Ayula, where we go over a whole plan of care as well as their genetic testing results.
And if they meet criteria, if they have reasons for follow-up further on, for example, breast MRIs or colonoscopies or pancreatic evaluations, we will follow them serially and longitudinally to make sure they get what they need and make sure those results don't show any changes, and if they do, get them to the proper place they need to go.
And so there are guidelines to manage those individuals, and they may need additional screening so that they get the proper and personalized plan of care that they need. And with individuals who are not diagnosed with cancer, we know that understanding what their risk is really develops a personalized plan of care for them for their lifetime.
But you can certainly change what you do, change your lifestyle, or change your medical approach to how you do your screenings that will help protect you from getting these cancers. Because the earlier you find the cancer, the earlier, most likely you are to cure it.
So I think part of it, it's so important that we take the time to listen. And one of the things that I love about what we do here is that we really do take the time to listen. So I think the level of support, emotional support that patients need is kind of baked into our program.
The CREP is just one way Penn State Health is helping patients conquer cancer right here in our community. Liz, back to you.
All right, thank you, Christina. To tell us more is Donna Lamp, Cancer Risk Evaluation Program Coordinator. Donna, thank you so much for joining us. You coordinate this program, and for those who might not know, what is the goal of the program and who really should consider genetic testing?
So I would say the ultimate goal of the program is really to devise a personalized, comprehensive plan of care. And that really helps an individual understand what their real risk for cancer is. Some individuals are so fearful about it, but once they really learn what the risk is and how to manage that risk, they're so much more comfortable.
That's what I was going to ask you. When they do learn that they have this increased risk for cancer, how do you guide them through the next steps?
So it's a multi-step process. So initially we provide education in regards to what their risk is. We look at their own personal risk factors. Those personal risk factors could be aging, things that we can't control. It could be hormone use. It could be multiple breast biopsies. It could be other family members, diagnosed with cancer, and even lifestyle. So we provide a lot of education in regards to lifestyle. We also counsel individuals in regards to whether or not genetic testing is the most appropriate approach for that individual. It may not be. Some individuals are just happy to have a risk assessment without genetic testing. One of the assessments that we do are breast cancer risk models. They're software risk models where we can calculate what their risk is in regards to a 5-year, 10-year, and even lifetime risk for breast cancer. And would they benefit from breast MRI or even a medication to reduce their risk for breast cancer?
One of the most well-known cancer-related genes is BRCA. So what happens if someone learns they carry that gene, and what do they do next?
So most cancer is not hereditary. About 5 to 10% of all cancers diagnosed is truly hereditary. Most cancer is sporadic, happenstance. Someone who is born with a mutation in one of the breast cancer genes, their risk is heads and shoulders above the general population to develop cancer. And we get our hands around managing their care. We follow them for the cancers that they're at risk for. And some of those cancers, we need to screen them for the rest of their life. And we want Penn State Health St. Joseph to really be their home, their medical home, where they feel comfortable in asking those questions and follow up.
All right, Donna, thank you so much for joining us. And we're going to send things back over to you, Christina.
Okay, thanks, Liz. And I'm joined now by Lisa Spencer, breast cancer patient navigator. And Lisa, you play such an important role when it comes to patients, guiding them through diagnosis, treatment, and even beyond. How do you describe what a navigator does?
Well, we pretty much do everything that's needed. We break down any barriers, we educate, we advocate, we help set up transportation, we work with patients with their insurance and finances. I tell everybody, just call me your go-to girl.
Your go-to girl. I love that. And, a diagnosis can be overwhelming. So how do you help with the emotional side of that?
Call me. I always say, call me. But I also recommend support groups. We have support groups. We have a support organization in the area. I tell patients to take care of yourself, practice self-care and mindfulness. And if needed, I can help to facilitate somebody going to see a licensed therapist or a licensed professional just to help them through what's going on.
So there are a lot of support groups and resources for patients and families.
Absolutely. We have 2 great support groups at Penn State Health St. Joe's. We have an English-speaking support group for all cancer patients, their families, and we have a Spanish-speaking support group, pretty much going over the same thing, but they're very active groups, and we love when people come and participate. They're monthly, and we love people to come.
Okay. Lisa Spencer, your go-to girl, your breast cancer patient navigator. Thank you for being here tonight.
Thank you so much.
Thank you. Liz, back to you.
All right, thank you, Christina. Coming up, we'll talk about how Penn State Health St. Joseph Cancer Center is leading the charge when it comes to advanced treatment for prostate cancer. Stay with us. Welcome back to our special Conquering Cancer. I'm Liz Kepner. As we learned in the last segment, genetic counseling is keeping families safe and informed. For men, an annual physical and simple blood test can do the same. Our final patient story tonight showcases the advancements in treating prostate cancer at Penn State Health. We're going to send things back over to Christina.
Hi again, Liz. And prostate cancer is a common cancer among men. New technology destroys cancerous tissue without harming surrounding tissue.
My father had prostate cancer, so he'd been watching my PSA for quite a few years. And just about a year and a half ago, Dr. Trapasso suggested, based on where my last PSA test was, that a biopsy was probably a good idea. At the follow-up, we found that I did have the cancer, and we started discussing options at that point. As far as my reaction, it was kind of, let's look at all the practical aspects, you know, before we let our emotions run away. It was not an aggressive cancer. The PSA was right at the limit between that low risk factor and intermediate risk factor.
PSA stands for prostate specific antigen. So it's a protein, it's floating in the blood. So any man with a prostate will have a PSA level that can be measured. But what we know is higher PSA levels suggest that there may be a problem. Maybe prostate cancer, maybe an enlarged prostate, maybe inflammation. The most important thing to realize, though, is that a higher PSA level at least warrants some type of medical attention. So in Mike's case, what's really great is I was able to talk to Dr. Trapasso. We were able to look at his disease parameters, the fact that they were sort of changing and evolving. And then one of the discussions was, hey, are we offering anything at different medical sites like Hershey that may be of benefit for a patient from St. Joseph's or vice versa? And really that collaboration is wonderful because oftentimes patients have to bounce between health systems. You have to get all your records together. You got to go to another health system. You have to start from scratch with a brand new person. And here I think you have the opportunity of having all of that sort of together and under one roof.
I had no idea that a procedure like HIFU existed, and I'm really grateful for Dr. Trapasso recognizing that I would be a good candidate and for telling me about it. So little or no side effects. Again, the repeatability, you could always go back and do HIFU again. You could do radiation after HIFU. So there are a whole lot of things that made it pretty easy to choose. But the description of the procedure was very easy, in and out of the hospital and the outpatient. Then the recovery was described to me. It was not a whole lot to worry about. Never needed any kind of pain medication because there was none.
You know, when I think about No Shave November, I feel like the overall theme of it, which is what I'm so passionate about, is being proactive for men, awareness, and getting them into their primary care provider's office to get screened, to get checked, to get their health maintenance done. I think women do a great job in general of preventative health maintenance. I think guys, as long as they feel well, would prefer not to be seen. You know, they feel fine, everything must be fine, but we know that's not the case. And so for me, the theme of No Shave November is, you know, we grow the beards and it's fun and there's a lot of publicity around it, but the theme and the message is to make sure that we're able to engage with people, to make sure they're getting in to see their healthcare providers.
Just make sure he goes to get his PSA test every year. The men generally are the ones that don't go all the time, and it's important. It's really important. And don't panic. If it gets caught early, it's not a death sentence, and you know, you can get through it.
it makes absolutely no sense not to go for annual physicals or PSA tests. No matter what the results are of tests, it's never better to find out later than sooner.
Thanks to research and development at Penn State Health, new and exciting treatments are changing the outcomes for cancer patients. Liz, back to you.
All right, thanks, Christina. We're now joined by Dr. Joseph Trapasso, urologic oncologist with Penn State Health St. Joseph Cancer Center. Dr. Trapasso, thank you so much for joining us. Prostate cancer is one of the most common cancers among men. My father has it. Why are screenings and regular checkups so important for early detection?
Well, like any cancer, early diagnosis is paramount to being able to cure the disease. Prostate cancer behaves typically like a cancer that can spread and progress and ultimately potentially cause the demise of the gentleman. The issue is that there should be a concentration like any sort of screening that we have for other cancers and the same focus for prostate cancer. And men at risk, higher risk, family history, even of family history of breast cancer in their female offspring. And in any event, the best thing to do is to continue monitoring patients for any potential cancer, such as prostate cancer with a PSA.
Penn State Health St. Joseph Medical Center now offers the HIFU procedure that Mike had for prostate cancer. How is that changing the outcomes for patients?
Well, HIFU is high intensity focused ultrasound, and it's a minimally invasive treatment that we are able to utilize for low and intermediate risk prostate cancer. And it involves a outpatient treatment that doesn't involve any cutting. The recovery is much quicker than surgery or radiation, and it's been widely applied for men who need to have treatment, who don't want to have the potential side effects of the more advanced types of therapy.
Penn State Health's urology team is also giving back this month through the No Shave November campaign. How does this initiative raise awareness and support men's health in the community?
Well, we try and have patients who have been treated, and also we get the community together to actually grow facial hair. And I'm not gifted enough to grow facial hair. That's one of my issues with November. But many men are, and then we are able to donate money raised by not shaving.
Right.
And there are different community groups that do this, and Penn State is one of the major groups in the area. And we've actually, through the last decade, have raised close to $1 million.
That's wonderful. Dr. Trapasso, thank you so much. We're going to have to wrap up our show now, our Conquering Cancer special. We want to remind you to check out our No Shave November campaign. You can scan the QR code on the screen that you're seeing right here, pennstatehealth.donordrive.com/NSN25. On behalf of Penn State Health St. Joseph Cancer Center, we want to thank you for joining us. Good night.